We have one of the most aged populations in the country in South Warwickshire, so we've been committed for several years to develop integrated solutions to care across hospital and community. But the particular thing that I want to talk about, which I'm most proud of, which I guess other people aren't doing in exactly the same way, is the preventive work we're doing in partnership with Age UK Warwickshire and with our colleagues in primary care. That project involves early identification of the concerns that older people have relating to their health, independence and well-being, and we provide a personalised response based on the top 1, 2 or 3 priorities that the older person has for need for support, information and advice. And then we underpin all of that with a shared information system, electronic information system, which sits alongside the assessments that professional health and social care staff undertake. We found the main barriers to our work were to do with the sheer volume of assessments that professional health and social care staff have to undertake in the course of their routine practice. And it was very difficult to introduce a more personalised form of assessment. The way we overcame that was that we realised that rather than asking professionals, staff in health and social care to integrate a person-centred assessment into their care planning, we would sit that alongside the professional assessments and work with Age UK, who through their trained staff would be able to conduct a personalised assessment with the older person of their health and care needs and then share that information with the professionals involved in their care. Now, interestingly, people thought that the barrier might be around information governance, sharing information with the third sector. But actually, I'm a Caldecott Guardian, so I'm responsible for information governance in my trust, and a very professional team that told us we could get around that by ensuring that people were information controllers across the sectors of primary care, social care, the secondary provision and the voluntary sector, and then we're able to share information about people's health and care needs across all of these sectors. So the main enablers to deliver this vision of maximising preventive care have been good working with the clinical commissioning group, and particularly a number of practices who were willing to trial the approach by writing out to people aged 75 plus, offering them an assessment, and then the assessment being done by our Age UK staff. So it's working with Age UK and the rich knowledge that they have in South Warwickshire about older people's needs and where older people's needs can be met often through services that are available through the voluntary sector. In our project, we've been measuring success according to the uptake, the popularity of the system with older people, and between 30 to 40% of the 75 plus population, when offered, have taken advantage of this. Then we've evaluated their experience of the system, and we've had some most wonderful feedback from older people saying that they'd never had these concerns talked about before. They thought there were things they just had to put up with, but now there are practical solutions being provided to them, and they've really enjoyed the conversations that they've had with their Age UK trained assessors. And finally, we've looked at the outcomes as a result of the assessment in terms of what happened next. How did the system change? Did it overwhelm us with demand? Not the case, but where the support was required. Now, we didn't have the £500,000 to do a randomised controlled trial, but there have been trials of a similar approach that we've used in other countries, because this is part of an international project. And we found in the Netherlands, where a similar approach was conducted, the impact in improving quality of life was so great that we could add 1 quality adjusted health year to life in an older person through this intervention for a very modest cost of about €600. So we think this approach is not just popular and it's targeting needs, but it's improving outcomes for older people at very reasonable cost. In order to develop these services at scale and pace, we're working with Age UK nationally. We've had interest from other groups of Age UK workers across the country. We're building up connections then with their local health and care systems. And we're putting this in the context of the international work where we're standardising the approach and the assessments in regional blocks. We're setting up a community interest company that will be able to properly underpin the work of this programme and make sure it's available to the maximum number of older people, both in this country and abroad. And we've had a lot of interest from clinical commissioning groups and from councils in getting into this work, because it's work that at the moment is really required. Preventive work, use of best information technologies and working with the third sector as equal partners, not as a sort of afterthought. So my 3 top tips for other sites developing integrated care services is don't just think about integration in responding to needs. Think about the integration in the way that we can identify problems at an early stage and maximise people's health, independence, well-being, number 1. Number 2, work with the third sector. There is so much intelligence and knowledge out there through third sector organisations, and we don't capitalise enough on that in the way that we develop integrated services. And my 3rd top tip is not to be afraid of using information technologies. If we can clarify exactly what we want in the way of shared information systems, if we define the purpose, then we can use information technology, we can share information in such a way that we can much more efficiently address needs and concerns of the populations which we serve.